Hi everybody, I'm going to share a little bit about Isaiah's motility disease. It's called Intestinal Neuronal Dysplasia Type B. So in short we call it IND-B. When he was born, he was a healthy full-term baby. I did notice right away that the meconium, that tarry black stool that a child or a baby passes when they're born, he took a little longer to pass that. Not that he didn't have a bowel movement in the first 24 hours, he did, but that meconium, to get him cleared out, was several days. Like, he just passed just a teeny tiny bit. So that was kind of our first symptom that something wasn't quite right, but that happened, so it wasn't like raising a lot of red flags. However, Isaiah struggled from that point forward, having bowel movements. He was breastfed for the first 6 weeks. They told me with breastfeeding, sometimes a baby can go several days, even a week, without having a bowel movement. So they kept reassuring me that it's okay. I kept saying something's not okay because he was straining, but nothing would come out. And so then they had us do several different things, and people all had lots of advice. Doing warm baths, certain exercises like stretches. We added prunes to his bottles. We did, what else? Several different things without anything happening. Then they had us do rectal stimulation, rectal dilation. Also, nothing happened. Then ended up doing an enema in the doctor's office, and Isaiah then passed a lot of stool. After that happened, the next week, again, no bowel movement, but he was straining and crying and in distress. Again, about a week's time went by. Still trying to use the prunes, warm baths, rectal stimulation, nothing. Have to do an enema again. So at this point, they're starting to think, okay, maybe there's something else going on. Let's do some more tests. Around, I think he was probably almost 5 weeks, 6 weeks old. They did a barium enema where they insert this dye rectally and do radiology, does a bunch of imaging to watch how that dye processes through the intestines. It helps to see if there's any sort of structural problem. So if part of the intestines is really narrow or bulging, they can see that with this study. And there was some concerns with the narrowing of his large intestine in the rectal area, like right where it drops down before it comes out. And so they sent us to Des Moines. In Des Moines, we saw peds GI and peds surgery, and they did rectal suction biopsies. Isaiah was awake. These are just like very quick and pretty much painless. He didn't even cry when they did them. They took 4 biopsies, and what they were looking for was if there was ganglion cells. At this point, they were thinking he had perhaps Hirschsprung's disease. A couple days later, we got a call back that the doctor did believe he had Hirschsprung's and made that official diagnosis. They recommended us to have a pull-through surgery. However, they wanted to wait about a month to do that. Pull-through surgery was meaning that they were going to cut off that bottom part of the intestine that lacked those cells and reattach it. Based on the research I read, if diagnosed with Hirschsprung's and you are going to do that pull-through procedure, it's better to do it right away. And so I was a little uncomfortable with the wait, and I just wanted to have a second opinion. At that point, I took him to Iowa City, where we met with Peds Surg and Peds GI, and they said, yes, we need to get that surgery done right away. And they got that scheduled a few days later. We came back for the surgery, and at the beginning of surgery, they have to kind of analyze how much of the intestine they want to remove. Obviously, they don't want to take out good intestine. So they do a deep tissue biopsy to make those evaluations. It was probably, I don't know, he was probably back in surgery for about 2.5 hours of what was supposed to be about a 5-hour procedure. And Dr. Shalansky, our peds surgeon, called us back because he was done. And I was really confused. But he made a discovery, and Isaiah did not have the pull-through procedure because on the biopsies he found there was ganglion cells. Again, with Hirschsprung's, there's no ganglion cells. Ganglion cells are like the collection of neurons, what the brain uses to communicate with the nerve to make it work. And there was indeed some there. They were abnormal and giant in size. So it wasn't Hirschsprung's, but at this point they weren't really exactly sure what it was. Pathology at University of Iowa, and our surgeons thought it could be the IND-B, but he was the only case that they had at the University of Iowa, with approximately 40 documented cases currently in the U.S. So the pathologist called in a favor to a pathologist in Seattle, and this pathologist, Dr. Kapar, is supposed to be one of the best in the entire world for rare motility diseases. So they sent over our actual slides with the biopsies from surgery that they took, and Dr. Kapar, I'm not exactly sure how to say his name, evaluated them and sent back a report that said his biopsies indicated and were consistent with IND-B. Unfortunately, with that diagnosis, it doesn't give us a lot of guidance or direction on what the future holds or treatment plans, just because it's so incredibly rare. Basically, I guess, I'm not a doctor, I'm not a nurse, I have no experience in the medical field. I'm just merely a mom with a child that's struggling with this. So I want to be able to always advocate for my children at, the best way possible, and I can't do that if I'm not knowledgeable. So I've done my own share of research, and just to help you kind of understand, say this is your large intestine and kind of curves and comes down to the rectum, and here you would empty out down here, right? So the area that we're talking about that affects Isaiah is this region right here. The cells that are in these walls are abnormal, so when the brain tells your intestines to kind of move, which serves two purposes, it helps with the fluid absorption and the processing of the stool, but it also is what pushes the stool down. So when this area is not working, there's a couple things that can happen. This area here can get kind of bloated out. Yay! And stool fills in this whole region because it can't get through here. So this continues to kind of get bigger and bigger. Sorry, baby, you want to be on the camera? You gotta draw a picture. Can you say hi? Say hi. Say hi. Hi. Which obviously, the more the area that balloons out, the more problems you can have. So you don't want that to happen. Management for the first 6 months was mostly enemas, routine enemas, because there wasn't a lot of other things that we had control over. From 6 months to 12 months, we introduced prunes, mostly green beans, foods that we could help really push things through, high in fiber. And what would happen was it would kind of give things more momentum. So this part where it struggled to go through, if there was enough bulkiness and I don't know how to explain it, force to get it pass through that section and down and out, we could make that happen through diet and milk and magnesium. It's a laxative that they had him on. We still did enemas probably once or twice a week. From 12 months to about 15 months, he transitioned to table food and did okay, we are having a lot of blood in the stool, so we had to modify his diet. He's on very strict diets. Try to avoid any processed foods, any foods high in sugar, anything like that. He really eats clean, like we all should. He likes meats. He loves his veggies. He likes fruit smoothies. Things like that. He does have quite a few carbs. He likes his bread and stuff. We try to limit it, but only drinks water or milk. The biggest way to manage this is currently through strict diet and laxatives and enemas as needed. He has been switched to Miralax because to get the dosing amount that he had to have for milk and mag, it was so huge, and he doesn't like the taste. Who does? Where Miralax is a powder that I can dissolve in this drink. So a Miralax dose for an adult, I think, is like a cap or something like that. Maybe it's a full cap, but Isaiah has about 1 to 2 full caps of Miralax a day. And sometimes that works, sometimes it doesn't. He, like I said, has a very strict diet, also still has prunes and all that. Prunes is his favorite food. Don't think a lot of us can say that, but it's probably the food he had first and has most often, so he really likes it. But we still do have to do enemas occasionally. In the last couple weeks, probably the last couple months, we've really struggled more than we had. We had a good couple weeks, but he kind of had a flare up, and things like antibiotics or any changes to his system cause a lot of colitis. He's very sensitive to even taking anything, so when he gets an antibiotic, which is harsh on our system, it's even harder for him to kind of deal with that. So long term, like I said, there's just not a lot of research that tells us what to expect or how we'll handle things. It's more of a wait and watch and deal with things as they come. When Isaiah turns 2, which is coming up here in a few months, and we start potty training, that will bring about its own set of challenges, but we'll handle it as it comes to us. I have reached out to the specialist in Seattle who did the diagnosis and probably is the most knowledgeable, and he explained to me that, in the field of medicine, this diagnosis is still kind of controversial because it's rare, there's not a lot of cases about it, and a lot of people don't understand it, which is frustrating for us, because even if I go to a clinic or the ER with Isaiah for something and try to explain he has motility disease, they're like, oh, he's constipated. I'm like, no. It's a little bit more than that. It's hard for people to understand. If you're not passing your stools, what other side effects and things can happen from that. So we monitor his diet. Everything he eats is documented. Every bowel movement he has is documented. Every medicine, when he takes it and how much, is documented. And that's been like that since day one. We have to follow everything. So that way, if he has a flare-up or something happens, we know what may have triggered it, or what we need to do to kind of rectify that. So I don't know if that answers more questions, but I know a lot of you have kind of inquired about what it is that he has, or what the plan is. I guess what I was starting to say, and I got sidetracked, is the doctor from Seattle did say that, kind of explained to me how IND-B came about. A Swiss pathologist, found a way to kind of stain those biopsies and count the actual neurons, the neurons that make up that ganglion, and so in a quantitative way, they then can distinguish if it's normal or abnormal compared to other children. So again, with Hirschsprung's disease, what they originally thought he had, there's absolutely no ganglion in the section. With what Isaiah has, there are, but they're abnormal and not functioning correctly. And you may ask, okay, if that region is the problem, why don't they go ahead and do the pull-through procedure like they were initially going to? Well, the problem with IND-B, unlike Hirschsprung's, there's still little research that they don't know if it's a problem that just exists in that region, that small region at the bottom of the rectum, or if it's throughout the whole intestine in like little spots throughout. So we would hate to do a major operation and still have a lot of difficulty. So I guess we just gotta wait and see and deal with things, like I said, as they come. I think that's about all. Diets, enemas, all that fun stuff. Lots and lots and lots of laxatives. Kind of our life for Mr. Isaiah. He doesn't have a lot of stomach cramping. We wake up a lot during the night with stomach aches. But we're doing the best we can with what we got, and I'm just trying to really research and make myself as knowledgeable as I can about this. I've connected with a couple other people around the world, one lady in Europe and another in the United States, who've also dealt with this with their children, and kind of looked at what their treatment has been, and really consider that too when I'm advocating for Isaiah. Anyways, I think that's all for this video. If you have any questions, feel free to ask, but that's really kind of a summary of what we know and what Isaiah has. So thank you for watching. Thanks for loving my baby. I appreciate it. It takes a village. Oh, bless you. Can you say bye-bye? Little kiss? Say bye-bye? Oh, you gotta push that for me? Uh-oh. Say bye. You gotta say bye first. It won't shut off. Mwah. Bye.